Be talking about muscle weaknesses, which is myopathies. So today we're talking about myopathies, and when you talk about myopathy, remember we'll talk about myopathy in under these headings. So the headings are going to be: the first heading is weakness, whether it's present or not; pain, whether it's present or not; ESR, whether it's raised or not; and CK, whether it is raised or not. So let's start with the first one, and that is GYM. And what is GYM? GYM is glucocorticoid induced myopathy. Now remember, glucocorticoids decrease the catabolism of your muscles and they increase the catabolism of muscles and decrease the anabolism of muscles, but they do not break the muscle cell particularly. It's overall atrophy. It doesn't allow it to grow, but at the same time it doesn't break down the cells, and that is why the CK here will be normal, because it's not breaking the muscles down. ESR on the other hand will be decreased because you're giving glucocorticoids. It cannot be high, so it will be normal. What about pain? Again, pain, glucocorticoids, when you actually give glucocorticoids for pain, so pain will be not there. And I'm so sorry, it's not normal, it's not there, absent. And weakness will be there because you're having atrophy, so weakness will be there. Let's move to the next topic, and that is statin-induced myopathy, SIM. Now, what do you think? Will there be weakness? Yes, there will be weakness because you're losing the muscle. Here, there is actual muscle breakdown, and that's why CK will be high. ESR will be. It can be normal, it can be high. We don't know because statin, like ESR, has to be normal. What about pain? So remember, it's a painful because you're killing the cells. Statins will kill the cells, and that's why pain will be there. So it's a painful neuropathy. Let's talk about a third neuropathy, which is polymyalgia rheumatica. Now understand, polymyalgia rheumatica is an inflammatory condition. ESR is up, definitely. It is not a muscle disorder. CK is normal. Pain is obviously there. Weakness, not necessarily. So weakness is not there because it's not a muscle disorder. Understand that. If it's a muscle disorder only, then you'll have. So what is exactly polymyalgia rheumatica? It's the connective tissue around the muscles, not the muscle itself. Fourth, let's talk about dermatomyositis and polymyositis. So the dermatomyositis polymyositis complex. Here you understand weakness will be there. It should be there, right? I'm so sorry. So this will be there as well. Weakness will be there. What about pain? Yes, the muscles are painful, tender. It can be there. ESR definitely raised. CK definitely high. Right? Makes sense? Let's go to the fifth one. And the fifth one is going to be hypothyroid myopathy. Now remember, whenever you have hypothyroidism, you cannot have ESR high. So ESR goes away. Hypothyroid, remember it, when you have hypothyroid, your muscles need thyroid to actually stay alive. If there is no thyroid, your muscle cells will start to die, CK will go up. So remember, muscles need thyroid to stay alive. And now because there's no thyroid, muscle cells die and CK is high. Will there be pain in hypothyroidism? Yes, if your muscle cells are dying, you're basically killing it. It's going to be there. And what about weakness? It will be there. So if you look at the pattern here, you can say statin-induced myopathy is almost like hypothyroid myopathy, isn't it? So let me repeat it for you. Hypothyroid myopathy is almost like statin-induced. So statin will itself kill it, and hypothyroid less. So what conclusion we can draw from here is that statins, they kill the muscles, and thyroid, they protect the muscles. So thereby it's very conclusive. More statins, more the killing, lower thyroid, lower the protection. This is the table that you can keep in mind. And if the muscles are killed, pain and weakness will be there. So now let's revise what we have read, because this is ultra important. So we talk about glucocorticoid-induced myopathy first. And because it is glucocorticoid-induced myopathy, weakness will be present because remember glucocorticoids will cause atrophy. So whenever you talk about glucocorticoids, think of it as atrophy of muscles. So it's causing atrophy. All right, it's causing atrophy of muscles. So it's causing atrophy of muscles. Weakness in an atrophied muscle is definitely present. Pain in an atrophied muscle, it's not, there's atrophy. Why would you have pain there? ESR is normal, CK is normal. Because it says atrophy, there's no breakdown. There's atrophy, there's no breakdown. So gym causes atrophy of muscles. So you can understand, let me repeat it again. Atrophy will not kill the muscle cells. CK is normal. Pain will be there? No, because it's atrophy. Weakness will be there? Yes, ESR is normal. Statin-induced myopathy, hypothyroid myopathy. We have already talked about this. More the statins kill it. And less lack of hypothyroid hormone again kills the muscles. Thereby, when you kill the muscles, pain is there, weakness is there. That's done and dusted. Both of them, ESR will be normal. Finally, CK will be raised. Polymyalgia rheumatica, it's not even a muscle disorder. So weakness won't be there, CK will be normal, but it's an inflammatory disorder. ESR will be raised, and pain because it's the inflammation of the connective tissue around the muscles. Dermatomyositis, polymyositis, this is completely muscle disorder. Weakness will be there, pain will be there, ESR will be there, CS, everything will be raised here because this is typical inflammation of the muscle. And that wraps up our myopathies. And very, very important question, because sometimes they'll give you a vignette where a patient has temporal arthritis. This is how they ask the question. So they tell you a patient has temporal arthritis, and 6 months down the lane, the patient develops weakness of muscles. And the first thing that hits our head is this polymyalgia rheumatica, because that's the association. And that's where they tackle you wrong, because the treatment for temporal arthritis is glucocorticoids. So if you're giving a patient glucocorticoids, how can he develop some inflammatory disorder? That's the first thing. Second, they'll tell you that the CK and ESR are normal. Once the ESR is normal, CK will be normal here, but the ESR cannot be because it's an inflammatory condition. And the treatment for polymyalgia rheumatica itself is glucocorticoids. So if the patient is already on glucocorticoids, how can the patient develop glucocorticoids? And remember, glucocorticoid myopathy is of two types. One is acute, the second is chronic. The acute one develops only in acutely ill patients, whereas the chronic one, which is the more common one, occurs when the patient is taking higher doses of long-term corticosteroids. And that kind of wraps up the lecture on myopathies of the body. Thank you.